Now you have a chance to think a little more long-term. I know you're just thinking, when are you going to get through anatomy? But let's take us 10 years from now. What are your aspirations for what you want to be doing, what you want to be 10 years from now?
Do you want to go first?
Sure, yeah. Okay. So I guess for me, I was out of school for 3 years as well. And in that time, I became a registered dietitian, worked with a very vulnerable population in the community, homebound elderly. And that served to show me just how poorly the healthcare system works for a lot of people, as I'm sure you know as well. And so I guess that really inspired me to kind of take a very large step back and look at, where can I work with a really strong preventative focus. And I think that for me is OB-GYN. I'd really like to work with, a young, relatively healthy population where I can bring my nutrition background and really serve to modify those chronic disease factors and modify their lifetime disease risk, not only for my patients, but for their children as well. And so 10 years from now, I'd really like to see myself in a multi-specialty kind of integrated practice unit, combining OB-GYN, psychiatry, social work, nutrition, and pediatrics even as well, to really target those women and their families where I can have a big impact.
Great, good.
Okay, so Jessica and I joke that if you were involved in Meals on Wheels in East Austin, you became the president of Dell Medical School student body, because I as well, I was a Meals on Wheels, I have been a Meals on Wheels driver for years, and I, in 10 years, hope to be serving in geriatric populations that are underserved in East Austin, Travis County. Especially, I'm really concerned about the old in public housing, because they lack a lot of the advocacy that we give to our parents as they age, or our grandparents, or our friends. So I would like to be here. I would like to be doing medicine in a way that is instructive and building up in the same thing that Jessica said, using all the resources of like interprofessional teams to change how we help people who don't have the tools to navigate the healthcare system for themselves, which is what we often ask of people who have lists of chronic diseases, and it doesn't work for them. So that is my big dream. In terms of where I end up as a specialty, I don't know, but I hope that my work as a physician has a rippling effect in terms of the things that I advocate for and the way that I advocate for it. I hope that it affects healthcare in a positive way here over the next multiple decades.
Good, thanks. So those aren't traditional goals that you've set for yourselves. So Michael, a few years back, when you and Susan decided to help to make the school a reality, and I really don't think we'd be here if we hadn't had your critical help at that time. What were your aspirations for the school? And then how are we doing so far?
Well, I'll tell you, you're off to a good start, so that's good. First of all, I'd say this isn't a new idea. It's an idea that has been a long time in the making, and it certainly wasn't our idea, right? A lot of people have been involved in this for a long time, many of which were mentioned earlier, but many others as well. And it was kind of an obvious thing, right? that we needed a medical school in Austin. Now, when you step back and think about it from the aspect of aspirations, I think first of all, I have aspirations for our community, right? And what that can mean to community health and attracting the talent to create a world-class community of care here in Austin. I also think that the medical school can be a catalyst for economic development. And certainly, if one looks at what's going on in technology and the information sciences intersecting with the biological sciences, that's a rather interesting area of growth. And I think there can be all sorts of great economic growth that occurs as a result of the medical school here. And certainly Susan and I, as we've lived here for over 3 decades now, and we've tried to find ways that we could make a difference and help out in the community. And I think this is one that we're going to be most proud of. So we're very happy with the start, and you know, you're doing great.
I didn't ask it to get a compliment, but thank you very much. That's a great, and we hope to make you even prouder. We're just getting going. So do you all have questions?
We do.
Yeah.
Do you want to start off this time?
Sure. So, Michael. We've been excited about this moment. Can you tell? We wonder how you will gauge the success of your investment over the next decades in terms of our student body and the student bodies to come. What's your dream?
You know, as it's been talked about a lot, you know, you all have a special opportunity creating this from a clean foundation to be able to do things in a very different way, and you know, that's a unique thing. You know, I would certainly love to see Austin be a model community for health in the world. I think we have already some great basis for that. And I think the healthcare system in this country, in fact around the world, is facing some real challenges, you know, maybe you know, epic challenges. And so you know, a real aspiration would be that the physicians coming out of this medical school help address that. That's a high bar. And in fact, I'm going to take your question and turn it around and ask you a question, which is when you think about those challenges that are out there as it relates to wellness and healthcare, what are the biggest obstacles? And both of you have had experience as practitioners out there in the field seeing what has worked and what has maybe not worked.
You want to go first?
Sure.
Okay.
So for me, I think the biggest thing is it's really difficult to be an advocate and be involved in public policy. And I think that's where a lot of maybe physicians fall short right now, where we're focused on the patient interaction, which is incredibly important. But at the same time, there's this whole bigger, you know, ecosystem that's going on. And a lot of times, I think individual patients, but also entire patient populations can benefit from taking that step back and looking at that bigger system and maybe serving as a better advocate for the patients that we care for.
In terms of challenges that I bring to the table in terms of my experiences is that I have been a receiver of healthcare and my children have been receivers of healthcare over the years. And there are so many disparate pieces that are like the insurers, the physicians, the hospital systems, patients, patient families, and then to not even add on the layer of like a patient population that maybe doesn't have funding for itself or doesn't have private insurance or doesn't know how to work through the system. It's an incredible challenge to think about how to even understand those problems and then pull them together in any sort of way that will lead to effective change. And I appreciate, and I think that our class does, that we are not really being given a sugar-coated picture of what healthcare looks like at this point. When we sit around in our group pillars, which is our case-based learning, we talk about why it would be hard to be this patient or to go through this situation because the solutions aren't easy. So that is the challenge that I see looking ahead, especially wanting to work with a population who won't be self-insuring, how to learn from a physician's perspective, well, how are they going to pay? And what is their biggest worry when they leave my office going to be paying their bill or getting better? And that's not an easy thing to fix. But it's something that we as a society have to sort of wrestle with, like what, not only the medicine side, but also the funding side.
Great.
Yeah.
Good. Do you have a question, Jessica?
Yeah, and I'd like this honestly to be for both of you if possible. But my question is, you know, you both have taken incredible paths to get to where you are. And I'd like to know, what lessons in leadership would you like for us as the inaugural class to know to help us in achieving these tremendous goals?
Oh, that's a great question. You know, I have the fortune of being able to give some comments after you all don the white coats. And I'm going to talk a little bit about leadership. But I'd just say, you know, for me, fundamentally, it's it's not about promoting yourself as a leader. It's about working towards goals that inspire you deeply. And if you're true to those goals and they're important and you can convey why they're important to others, then leadership is just a natural byproduct of that.
I would say, don't be afraid. Be willing to take risks. What I've found in my life is that when I've either put myself or found myself in challenging situations, my capacity to respond to those was far greater than I imagined. And actually, I think most people don't actually get a chance to use a large percentage of their capacity as human beings. And I think one of the reasons for that is fear. And they're afraid of making mistakes. So, when we talk at the Dell Medical School about innovation and transformation and all these kinds of things, well, I think the key to those as well is being willing to make mistakes and take risks and learn from those mistakes. So a problem that I see generally in the world is people are too afraid to go and try things. That doesn't mean people should be reckless, right? And if you make the same mistake over and over again, I'm not talking about that. That's a different problem, right?
Yeah, no, I love that message, and thank you for giving us an out when we make that first mistake.
Well, you're gonna make some mistakes.
Yeah,
That's actually a good thing. So as long as you correct them quickly,
and we will.
You'll learn
That's
from
it.
that.
One of our
we're not the
things.
mistakes.
You've heard us talk about fail fast.
We've already failed some things fast.
Yeah. That's one of our key things is fail fast.
How fast are you learning? That's
exactly
the key.
Right. Yeah, you can learn from those failures. So this has been fun. Thank you very much.